Hi, how's it going? I'm Dr. Alvarez with Endobariatric.com, and today I want to talk to you about the staples, the titanium staples used to craft your surgery. We get a lot of questions regarding the staples. A lot of patients are concerned if they sound alarms at airports, if they are planning to get an MRI down the road, if they rust, if they stay in there forever. And I wanted to do a short video to explain. We got a whole bunch of our toys out, so I know you'll find this interesting. Now, the staples that we use during laparoscopic surgery, imagine yourself a regular staple used for paper. The idea it gets deployed and it hits an anvil, and the anvil will cause, of course, it starts as a U shape, and once it hits the anvil, it will bend the staple to create a V shape. So that is how it really works. It really works as a paper staple. But the truth is, the staples that we use during laparoscopic surgery, they're not that big. I mean, these are magnified for you for educational purposes. They're very, very small. At the end, I'll show you. This morning, I was able to grab a few of the leftover little staples. I gathered them and I took a picture so you can really see the actual size of those minor, very small staples. Remember, when we do laparoscopic surgery, we use these instruments, which is a linear stapler. Now, this is a linear stapler, but it's laparoscopic, so we call it EndoGIA, which stands for endoscopic gastrointestinal anastomosis. And these are made by the two main companies, which is Medtronic and Johnson & Johnson in the United States. There are other companies. We only use the top brands because of patient safety. And these staplers will staple 3 lines. Actually, there's 6 lines. 6 lines of staples, but it's 3 on one side and 3 on the other, and it will deploy a blade in between each cartridge, in between the tissue. So what you're going to be seeing in a laparoscopic surgery is 3 lines of staples on one side, 3 on the other, and once the blade is deployed, once it cuts through the tissue and the stapler opens and releases, you'll see that it cuts the tissue, but there's no leakage, there's no nothing spills out, there's no blood, there's nothing, because the staples are squeezing the tissue side by side, and that's what they're supposed to do. Now, the staples are made out of titanium. They are premium metal. This is non-magnetic, so patients are able to get an MRI down the road. It won't affect, and the amount of metal inside the patient is so small. It's probably all around is probably less than my ring. It's just minimal amount of titanium inside your body. The staples are titanium. Why titanium? Because titanium is the only material known to mankind which is 100% biocompatible, and what that means is there is no allergic reactions to this metal. Yes, there can be an allergic reaction to any other metal, like for example gold, like for example silver, like for example nickel, but the staples are made out of titanium. That's why they are so expensive. So nowadays we use top technology. It's just amazing how far this has come. Staplers have been around in the surgical field for decades and decades, and nowadays 2020, this technique, the improvements in the staples is just amazing. Back previous technology, back a few years ago, what we used to have is a regular anvil, squared anvil, and the staplers would fire or release or deploy the staples, and it would hit the anvil. And once we would hit the anvil, of course, it would create a V-shape staple. Now, that those staples, if for any no reason, if the tissue was very thick, if the tissue was not correctly dehydrated prior to the firing of the staple, or any other issue, if this staple would come down and it would not hit the anvil in the correct position, it wouldn't form a correctly V-shape staple. So nowadays, or even cause a misfire. Nowadays, with the current technology that we're using at Endo Hospital, what we are seeing is that the staple can actually go slightly out, and once it hits the anvil, it will correct and will form a V-shape, or force a V-shape staple to hold the tissue side by side. Now, I will demonstrate on this other camera the technology that we've been using previous years and the current technology that we're using at Endo Hospital. Current technology, or previous years, we would use these loads right here, and these have the same height of staple, 3 lines, but each line would have the same staple height, the same thickness. Nowadays, that's the current technology, or what we used to use prior to maybe I want to say 4 or 5 years ago. Now, recently, we currently are sticking to tri-staple technology, and the reason is because the staples have a different height, 4 millimeters, 3.5, or 3. And this height will adapt to the tissue's height or thickness, creating a better and more secure staple line. So this is what we're currently using at Endo Hospital. This is what we used to use back then, which would be the old version of the old cartridges. And truth is, it's very secure. The amount of staples, staples deployed by one of each cartridge is probably about 80 tiny staples that I'll show you, and they don't rust. They won't interfere with causing any allergic reaction. You don't need to go back for them. That's another question. Do I really need to go back to get them out? Will they stay in there forever? The answer is yes. They stay in there forever because they hold the tissue side by side. Oh, nice. I can get this out of the way and this out of the way so I can show you. And they're designed to hold the tissue in place, for the following days to a couple of weeks, and that's enough time for this to heal. But once this heals, as you can see here, I mean, even if I try to remove this, this is embedded in here. Once it's embedded in here, I mean, it's just useless going back. So the staples stay in there, and it won't cause any issues. Just because you're watching this, just because you've been informed on all these procedures, you've done your homework, you know that there are staples inside your body. Otherwise, you would never ever known down the road, because they won't cause any issues down the road. So again, you won't sound alarms at airports. They don't rust. They stay in there forever. You don't have to get them out, and you can get an MRI after your surgery. I just would suggest you wait at least 21 days before getting an MRI, and no allergic reactions, so don't worry. I mean, go with the flow, craft your new surgery, and go toward a better and healthier lifestyle. So I hope that you find this useful. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.